The first step in throwing in a soccer ball is a prep position. In this position, we will see the shoulder in its neutral position, and it will not be using any muscles. Um, for the elbow joint, it will be in flexion, and the bicep brachii, the brachialis, the brachioradialis will be in action, and for the wrist, it will have the extensor carpi ulnaris, the extensor carpi radialis brevis, the extensor carpi radialis longus, extensor digitorum, extensor pollicis longus, and it will be in extension. All of these movements are in the sagittal plane and transverse axis.
The second step in throwing in a ball is bringing the ball behind your head. During this, we will see the shoulder joint in flexion. It will activate the upper fibers of the pectoralis major, the anterior deltoid, the long head of the bicep brachii, and the corticolealis. Moving down to the elbow, it will also be in flexion, and it's going to activate the bicep brachii, the brachialis, the brachioradialis, the pronator teres, the flexor capri radialis, palmaris longus, flexor carpi ulnaris, the flexor digitorum superficialis. At the wrist, which will also be in flexion, we'll see the extensor capri ulnaris, extensor capri radialis brevis, the extensor capri radialis longus, the extensor digitorum, as well as the extensor pollicis longus. These will all be in the sagittal plane, which are on the transverse axis.
In the third phase, which is the release phase, the shoulder will start to extend, and it will be using the latissimus dorsi, the teres major, and the teres minor, and also the tricep brachii. And the elbow will be in extension as well, and we'll be using the tricep brachii, the extensor carpi ulnaris, and the extensor digitorum. For the wrist, it will be using the extensor carpi ulnaris, extensor capri radialis brevis, extensor capri radialis longus, extensor digitorum, extensor pollicis longus, and is also an extension, which all of these are in the sagittal plane and in the transverse axis.
The fourth phase while throwing in a ball is the follow-through. During this, we will see the shoulder joint in extension, activating the latissimus dorsi, the teres major, teres minor, and the tricep brachii. Moving to the elbow, which will stay in extension, it will be activating the tricep brachii, the extensor capri ulnaris, and the extensor digitorum. Moving to the wrist, which will be in pronation, we'll be activating the extensor capri ulnaris, the extensor capri radialis brevis, the extensor capri radialis longus, as well as the flexor digitorum superficialis, the flexor digitorum profundus, and the flexor pollicis longus. These will still be in the sagittal plane in the transverse axis.